I'm very excited for my guest I have with me today, Dr. Keisha Downey, who is a psychologist, licensed marriage and family therapist, mental health and relationship expert, as well as somewhat of a movie star, being featured on VH1's Couples Therapy as a resident treatment counselor for the past 4 seasons. Dr. Downey, how are you?
I am good. How are you doing this morning?
I'm doing wonderful. I'm doing wonderful. I appreciate you making time today. I know you have a really busy day, as always. You and I had the pleasure of being able to meet in Chicago several weeks ago through the Howard Moore Foundation. We had Lorenz Tate, Stephen Bardo, Marcus Libby, a lot of basketball guys and actors coming in, thinking about how we can figure out how we can help with the gun violence that's taking place. In my background as a sports psychology consultant, I was able to bring a mental performance discussion to the table. But when you and I got a chance to meet and talk more, we realized that there are other issues going on that the mental performance may be on the surface, but there may be some other mental health issues that are taking place. So can you give me a little bit more about your background and the work you've been doing and how that may kind of come into play with what we're talking about today?
Okay. Well, I have been in the therapy realm or doing therapy since about 2004.
Mm-hmm.
So I've been around the block a little bit in this therapy thing. But
Sure.
my experience more recently has been focusing on a lot of patients who are suffering from anxiety and depression, and then their
Okay.
relationship issues, whether it be family relationship issues or couples issues or what have you. And that's more recently. My resume kind of extends back to working with foster care youth, people in the juvenile system or what have you. So I don't know, when we met several weeks ago at the event, it was really refreshing to hear about people coming together to try to find ways to build back up the communities and bring back um, the resources or how we can tie in mental health to help out these disadvantaged youth or individuals.
Sure.
So I don't know, like I'm kind of one of those types of psychologists that pretty much I don't discriminate. I can pretty much work with anybody.
Okay.
Um, so it just really depends on what you kind of need. But again, more recently, I've been working with a lot of individuals in the Chicagoland area and in California who are suffering from anxiety, depression, trauma, like I said, relationship issues. And I feel like this can tie into the sports realm because a lot of those individuals who are athletes, whether young or adult, they do have stressors stemming from family, stemming from, relationships, you name it pretty much. So therapy can play a role in it. And that's where I come into play.
Oh, so good, so good. You said a number of things I kind of want to touch on. When you talk about anxiety, that's something I deal with on a regular basis, dealing with my athletes, maybe pre-game or post-game. But can you clinically define anxiety, depression, and trauma, just so we have a good working definition that's not what someone just pulled out the sky or think their definition should be?
Okay. Well, if you let's start with anxiety. So we have what we like to call our DSM, which is our Bible, which is what we follow or abide by. Because you're right, a lot of people will do Google searches, WebMD to try to diagnose themselves, which is so not the right route to go.
Sure.
Anytime you're experiencing some type of abnormality or just not feeling yourself, you do want to go to a professional who can help determine what is really going on. So again, when you're acting out of the ordinary, or if you see someone who's acting out of the ordinary or just not, they don't seem to be themselves, you want to try to get that person help, or you or that person go seek out help. Anxiety specifically, there's different types of anxiety. One of them being post-traumatic stress disorder. But we
Hmm.
can just start with the general anxiety. Anxiety pretty much stems from a huge stressor, not all times, but there's typically a stressor that has occurred in a person's life. And that stressor will start to cause the person to exhibit certain behaviors, which could be worrying often or worrying excessively,
Hmm.
irritability, feeling on edge or keyed up,
Hmm.
ruminating thoughts,
Hmm.
and the list kind of goes on. And you sometimes you can't control the thoughts, right? And so sometimes that diagnosis will extend over to what's called generalized anxiety disorder, where you just can't stop the worry. And
Mm.
sometimes you're worrying about things that you really shouldn't worry about.
Sure.
So that's just the general aspect of it. But you have some people who will come in and they might not meet the full criteria for generalized anxiety disorder. They might just be like, you know what, Dr. Downey, I've been just worrying more than I usually would, and I just can't seem to control the thought. And it might not be no other symptoms or behaviors. We might give them just what's called an anxiety disorder, not specified, meaning that they don't meet the full criteria, but something is going on. What I'm finding, which is very interesting, individuals or my patients are coming in because of what's going on in the world with society, with the
Mm.
president, just with Kavanaugh, I mean, you name it. And they're coming in and we're kind of, what's been happening, I've been diagnosing people adjustment disorder. There's this huge adjustment or shift, which again is a stressor, a huge stressor, and it's causing individuals to exhibit some of those behaviors that I just mentioned. And so what we have to do as psychologists, we have to help them properly adjust to that huge stress or whatever is going on in their lives. So that's just kind of like an
Sure.
overall
Oh,
idea of
no, that's
anxiety.
great. I mean, you really got into some things that probably will make people aware of something they didn't think was really an issue. So, how do you respond to people who may be going through an adjustment issue or the general anxiety disorder when people around them in their circle or society say, hey, just toughen up. You need to be more mentally tough or get over it, or these general type responses to someone who really needs a little bit more help?
So one thing that I do is when someone comes in, I always allow a safe space for them to open up. So you're right. When people say, tough it out, don't worry about it, you'll get through it, that kind of lets that person or that individual know, like, man, you know, I can't really talk to this person. Like, I have no outlet. So
Mm.
what I try to do, actually, what I do is I first make the person aware that this is your safe space. I'm your sounding board. Like, let out whatever it is that is going on within you. Because as you know, with stress, typically it's a buildup of
Sure.
so many different things that are going on. So what I try to do is I try to engage the person into just utilizing the time with me, you know, having this open space to just really talk about what it is that they're feeling. Because again, when you're around individuals, like you just mentioned, who say toughen it up, that lets that person know, okay, I can't really open up or talk to them. So providing a safe space to answer your question and allowing them room to just discuss their inner, most deepest thoughts.
Sure. Very good. On that same point, I've had some experiences with athletes on all levels and even on the NBA level. I've had general managers from teams ask me, Lindsay, how do I get a guy like you to come in without my players thinking they're effed up? And he actually used another word, but this is
Right,
Sunday
right.
morning, so we'll be appropriate. My point being is it was a shock to me because this is, a team with one of the best players in the world on it. I mean, all these things, and I was shocked. So to your point about that safe space, how do you go further to help develop that trust or to get someone to even be open to taking those steps to come and meet with you or someone like myself or just having this conversation?
So my niche is rapport,
Rapport.
rapport building. So without that, there's no movement.
Okay.
You have to build that therapeutic alliance, that therapeutic relationship. So pretty much just relating to that individual. Like, I would never have someone sit before me and just dive right into, okay, tell me what's going on with you. Like, you have to set the stage up. You have to allow the person to be comfortable. And they need to know that you're real too, you know, that because a lot of times when people come, they just say, can you fix me, Dr. Downey? Like, what's, you know, help
Right.
fix me. And I'm
Right.
not a fixer. You know, I help
Right.
you see things from a broader context and just help you to figure things out. So I just try to reiterate to people I'm a guide just to help you kind of come to your own conclusions. But to answer your question more specifically, rapport building is super, super important, especially working with kids
Mm-hmm.
or even adults, like you said, like letting them know this is real. Like, there's so many other people that are dealing with some of the same things that you're dealing with. It doesn't mean you're effed up or crazy or what have you. You're just
Sure.
dealing with life right now. So yeah.
Sure. Now, as a professional, how do you manage that when obviously you're being paid for your services? You have a huge, huge clientele that I know that you talk about. You got so many people you're working with. So how do you work on building a genuine rapport when the time may be somewhat limited that you have to access a person or anything like that?
So I can use my current private practice experiences right now. The people, when they come in, and I'll just kind of walk you through what
Sure,
typically happens.
please. Please do.
So right now I'm working at a Northwestern hospital clinics. And so as soon as I introduce myself to a patient, I walk out to greet them. And as we're walking in, Lindsay, I'm already like, how's your day going? You
Mm-hmm.
know, how you feeling today? Do you work
Sure.
near here?
Sure.
Wow, you know, this is a long hallway. We got to walk down to get to my office, but I promise you. So you see, I'm kind of getting them to loosen up already as
Sure.
we're walking to my office.
Sure.
So I'm
Sure.
setting the stage up to let them know, like, I'm an okay person. Let your guards down a little bit and just loosening them up. And 9 times out of 10, those people are feeling, I'm knocking the edge off already as we're walking to my office.
Sure.
So then once we sit down in my office, I kind of explain just the logistics and the procedure of what it is that's happening today. A lot of people, the fear of therapy, they have no idea what they're walking into.
Sure. Sure.
Because remember, they have those stereotypes, they have the idea of what therapy is, and so they're nervous. So you have to like break down those barriers or those preconceived notions about what therapy is.
Sure.
So at that point, after I've set the stage as to what's going to happen in therapy, I mean, if I set it up to you as to what's about to happen, wouldn't that make you feel a little bit better about the process?
Absolutely.
And go ahead, sorry.
No, I'm not interrupting. I just do know that what you're sharing is not only a benefit to me, but also to my colleagues. I've heard many stories of sports psychology consultants who will show up at an NBA practice and go up to the players and say, okay, who wants to talk? And they all look at him like his eyes are bugging out of his head, say, no way. But what you just shared with me, even in your immediate rapport building, that you share somewhat of a, I won't say vulnerability, but you kind of come down to their level. In this
Yep.
profession, as you may know, many of our colleagues in this profession may have a very, I won't go as far as say a God type complex, but maybe very elitist in their approach. So immediately the person who's meeting with this individual may feel a little less than, but what you've done is you've humanized the experience already. You've shared a little bit of yourself. You've taken yourself out of being this big must-see person compared to being someone who can help and guide. And I just thought that was noteworthy when you talked about that.
Yeah. Rapport building is my thing. When I in my graduate studies, my professors always said you have to, at times, self-disclose to let people know that you're real and that you're human. And that's what I do. When it's appropriate, I do. I let my patients know that I'm real. I go through some of the same things that they do, and they really tend to open up. And that's how you build rapport with people. Again, if you're closed off, hands folded or arms, folded, and you're not allowing people to see who you are in a sense, they'll be closed off as well. So yeah, rapport building is super important.
Wonderful. Well, let me touch on these few things too. Getting back to our college athletes, because what I'm finding that we're dealing with is trying to push back against the stigma against not only mental health but even mental performance. Even in the profession, the term sports psychology, even from ASP, Association for Applied Sports Psychology, which is a wonderful organization, they are even advising that we move from the term psychology to performance because of the apprehension many people may have, which sucks because I bought all these shirts that said sports psychology solution, but it's okay. My point being is that even with my nonprofit work that I use to try to promote people being less apprehensive about dealing with mental performance or dealing with the psychology of things, what are some things that you think are important for us to be doing as a whole in society to help take away that stigma that comes with any discussion about mental health or mental performance or psychology?
Education.
Okay. Okay.
I
Okay.
mean, that's that's really what it's about. A lot of people do not know the resources that they have. You know, you have to make it. Uh, Therapy has to be made to be an okay thing to do, right?
Okay.
So it's just educating people about what it is, especially in our communities. You just have to educate. I mean, that's really what it boils down to, like allowing people the resources or providing them with the resources to know that if you are, again, feeling not yourself, or if you know someone that is acting a little differently, these are the resources for you, because a lot of times people are not aware of what's out there. But again, education is really key. And we have to utilize the platforms though too. So just getting out there, whether
Sure.
it's radio stations, attending, going to the schools, talking to the, the athletic directors or what have you at these colleges, and just
Sure.
letting them know that we're there. But education, trying
I
to
like
find
that.
ways to, yeah.
I like that. That's really helpful when you talk about education. That really inspires me with my work, which is why I created the nonprofit SPS, to really get out and to be able to share without me losing my shirt, no pun intended, with just trying to go everywhere and help everyone. Perfect example was where you and I met at the Howard Moore Foundation
Right.
in Chicago, which was a great thing. Now, something you talked about earlier that I want to kind of get back into that kind of connects me with the things I'm working on with you as well. When you talk about the relationships, I once heard a coach, uh, Tom Izzo from Michigan State, make a point that when a player is having a tough time on a court, in most cases, it has something to do with something happening off the court. And one of the first questions he asks is, what's going on with their relationship? So can you talk about how, though we may not try to acknowledge it, but how our personal, interpersonal relationships can have a total impact on our daily performance, whether it's as an athlete, whether it's as a professional, but talk about the role relationships plays in our everyday life.
Man.
Like how much time do we have, huh?
Right. As humans, we feed off of human connection, like having that connection with the person. So the power, the impact of a negative interaction, onto you, it really can, it can weigh on you. So again, just to rephrase that, because human connection, that human interaction is so important for individuals, if it's not going well, right? If something is happening or there's conflict with another person that you're close with, it can in turn impact you in the workplace, which for athletes, their job is to, be on the court and perform. So, man, it happens all the time. It's like clockwork. If you're not having, if something happened within a relationship, or I don't know, family relationships, anything, it tends to spill over. But that's why people have to utilize the proper coping skills. They have to take a step back and realize what's going on before they enter into, that workforce, whether it's basketball, football, whether it's even, someone like me and you. So again, people sometimes they forget to take a step back.
Sure.
And utilize their coping skills. And I think that's the part that's missing. They'll just have that negative interaction or relationship issue, and then they don't wash it away for a second. They don't take a step back and just realize, let me just cope with this, take a deep breath, utilize some type of technique before I enter into, that workplace. What they do is they just kind of rush, get into it, and they haven't really processed what's happened.
Sure. You make an excellent point. One thing we talked about when we were in Chicago is stimulus and response. And one of the coping mechanisms I try to promote to my athletes is mindfulness, because there's a stimulus, which may be your phone, which may be the relationship, maybe the coach. There's that freedom to choose that we overlook. And then there's the response. And in many cases, we just have the stimulus and we rush right to the response, which is something we regret. So let me ask you another relationship question, because your bio says that you can fix any relationship, right?
I try.
Well, so here's my question with that. So let's say I recognize that there is a issue with the relationship that I have, whether it's a working relationship, whether it's, the conversation I have to have with Dr. Downey when we have to do our Skype, or it's with my business partner, or it's with my significant other. Are we always, should we always be on track to try to fix the relationship issue, or just be mindful that there is an issue and try to progress? Meaning, do I stay up all night to get this thing right, even if you may be in a different mindset, I'm in a different mindset, or do we just recognize that there's an issue we have to work on?
Recognize there is an issue that we have to work on.
Okay.
Like that. That's dead on. There is no perfect relationship ever.
There's not?
If it is,
you have to come across getting all your patients, right?
Right.
To stop, how important it is to emphasize that, though, that there is no perfect relationship.
Man, I'm telling you, people think that there is, though. I mean, and that's one of the things that I say. It's like kind of my spiel with my couples that I work with. There is no such thing as a perfect relationship. If people are striving to be perfect within a relationship, I feel they will fail, because we're only human. You're going to get upset. You're going to get angry. You're entitled to cry. You're entitled to have arguments. The key is fighting fair. That's the key.
Fighting fair. Oh, wow.
Fighting fair.
Fighting fair. Talk about that. What's fighting fair? Dr.
Fight
Downey.
and fair means we can debate, we can argue, but no name calling, no belittling, no, hitting, getting violent. Just fight fair, listening to one another, not over talking each other. But again, those things have to be taught to some individuals, because when they sit before me, the communication is out of whack. They don't know how to navigate the emotions because they're so
Sure.
caught up in their own stuff. So I just
Sure.
have to help them kind of see things, which goes back to your point, recognizing that there's a like recognizing it. That's the
Sure.
first step.
Sure. Dr. Downey, I'm purposely going to try to wrap this up because I got a feeling if we keep going, we will have a marathon session. However, I think my goal is to be able to share what we have on a platform to make people see that there's an opportunity and look at maybe reconnecting with what we have to kind of follow up on it. Because the last thing you said about fighting fair, this is one thing I'll throw out there. This is not to put fuel on the fire or to get us talking for another extended amount of time, but how do you fight fair when many people, the only tools they've used are the ones you named as bad tools, meaning the belittling, the name calling, because that is just what they've been used to. So how do you shift from this being my toolbox and what I have to moving to the fighting fair that Dr. Downey supports?
Modeling, just
Okay.
modeling. So
Okay.
one thing to note is the brain is a muscle. The
Mm,
brain is a muscle. So we can rewire it. We strengthen it. Because what do we do with muscles? We strengthen our muscles, so we can rewire the
mm,
brain. So the goal is to model in the therapy session how things should be. If you practice and practice and practice and practice something, you can uncondition what's been conditioned. It takes a lot of time and
mm,
effort and strength. But again, it just takes practice. And what we do in the sessions is everything that we do, whether it's individual therapy, couples therapy, family therapy, you set the stage of how things will be, and then you model it. And we
mhm.
practice it every time with the hopes that those individuals can change their way of communicating. Now, do we get individuals that are resistant or hard? Absolutely. Then I might refer somebody to individual therapy to work on
Okay.
their own stuff. You know what
Okay.
I mean? So that it doesn't disrupt the couples or the family's process. But to be more specific, when you have individuals that are used to reacting or respond in a certain way, it requires a lot of practice and open mindedness. You
Hmm.
have to be open to
Sure.
change and wanting to change.
So to that point on practice, and this is, I hope you know, and you got my juices and my blood flowing just hearing these conversations. So I'm excited about what the potential could be. But back to practice, an athlete will practice his jump shot because he wants a scholarship, he wants to make it to the next level, etc. So there is a self motivation. Now, how do you motivate someone to practice on their relationship skills when it seems like there's no tangible benefit right there? Because with basketball, if I practice, I make the shot, I win the game, so to speak. But where do you see or is there such a tangible benefit in a relationship?
Everybody wants to be loved.
Sure.
Maybe that's what it is. If two people sat before me, even a family or a couple, everyone wants to be loved. Everyone wants to feel good. So maybe that's that tangible. Maybe that's that thing that we strive for, to feel
Sure.
good,
Sure.
to be loved or what have you, to be able to get the things that you want and need from that individual. So maybe that's the goal, so letting them know like, hey, things might be rocky, or we have to practice within a relationship so that we can get to that goal of the love that we need. Because again, everyone needs love. That human interaction, if it's a positive interaction, ooh, we want more of it. You know what I
Sure.
mean? So maybe
Sure.
that's what it is. Like you said, college athletes, they want those scholarships or they want to go to the NBA. That's the goal. Well, in relationships, we want the love. We
Mm,
want the love. We want that good feeling. So
sure.
that's what we work towards.
Oh my. Well, Dr. Downey, on that note, I am going to wrap this up because what I would like to do, if your schedule permits, is that after sharing this, maybe we can have a time to share, more discussions like this with more people, maybe even doing it on a platform that allows for some live interaction where people may
Yeah.
come with questions that work. But I really feel that you and I together can really help build a rapport, as you said, with individuals to make them a little bit more comfortable about addressing not only mental health but mental performance, and we can work on having a positive impact on others. Now, is there anything else you would like to share, or is there any way that our fans can follow you? What's some good social media, other things to kind of follow you, to be aware of what you're doing, so we know what you have going on?
So my social media tags are Dr. Keisha Downey. So it's just Dr. and then KeishaDowney. And that's on your Instagram, Twitter, and my Facebook page as well. And then I do have my website, drkeishadowney.com, spelled the same exact way. One of the things that I just want to kind of touch on really quickly, or just to kind of do something. We got the holidays coming up.
I was gonna mention that. I'm glad you said that.
Yeah, holidays are coming up, and a lot of times people get the blues, or they get down, or their loved ones, whether their loved ones are incarcerated, deployed. Maybe there's been traumatic experiences surrounded
of a passing of someone.
Exactly. So depression and anxiety sometimes can be at an all-time high. So I just want to let the people know to utilize the resources. You know what I mean? Utilize the resources out there during these periods, because again, anxiety and depression can be high around this time during this season. So just use the resources out there. And again, when someone is acting not themselves, or they're doing or displaying certain behaviors that are not, don't seem to be them, whether it's you or someone that try to get them the appropriate help, and don't wait, because not to keep going with this talk today, but there's so many different things. Suicide, just people get to an all-time, it get really, really low. So we just want to make sure that there's resources out there for them, or at least give them the proper resources. Let them know they can call 311 or 211 from their landlines to find the appropriate or the closest facilities that they can help. Yeah.
Well, what we have to do, we have to keep making these resources available. I think you and I are able to connect with people in a certain kind of way that can make them, take a fresh look at the discussion that we're having, and really do some self-evaluation on their own to be able to find out what works. So my information is www.sportspsychsolutions.org. That's my website for any of your viewers who may pick up on this. And my social media is HSolutions1. And that's on Instagram and Twitter, but also a lot of this will be on my YouTube channel at sportspsychsolutions.org. But I'll tag all that. So we're coming up close to a 30-minute mark. We've had a great discussion.
All right.
Yeah, I just want to make sure that we get this information out and continue to be a resource. And I look forward to having you back on, Dr. Downey, and we can talk some more and hopefully bring some light to some situations for some people and even ourselves, right?
Absolutely. It was a pleasure, and thank you so much for having me on.
All right. Thank you so much, and we'll talk very soon.